Love many, trust few, and paddle your own canoe. That's what she said, and I'll just remember that for what it's worth. All right, thank you for taking this time to visit with me today. I am at this time celebrating over 50 years of dentistry, beginning in 1972 and coming up to the current time period. In that time period, I was in the military, had private practice, but I'm going to begin most of this and talk most of this with this conversation about my time period with Community Health Center. My inspiration began with God. That's my inspiration, to do something, to try to make a difference in the world. Motivation now comes from people around me. And those people are certainly my parents, my uncle, and my wife, driving me on to keep going. I have felt all along that the community health centers have served an overwhelming position of assistance to large numbers of individuals within our country. Community health centers already have a structure. There's some basic structure in place. And if I were a politician looking to try to find health coverage for people, try to get health care for people, I wouldn't try to reinvent the wheel. I would go back to the community health centers, find out what they have in place, get their input, and would begin there as a politician to try to help cover health care needs of the greater number of people within our community at large. If I were to advise a new healthcare worker, a dentist coming in, who would come in, I would suggest that they consider the greater value of their training towards the opportunity within a structured healthcare setting to provide the greatest amount of service and the greatest use of their talents that they could acquire in almost any regard. So I have very high regard for our community health centers, and I'm glad to be a part of it at this time. And going into the future, I would hope that I would still be able to continue to serve and to listen and to be able to be a part of improving the welfare and the wellness and the self-concepts of our community that we have the opportunity to serve. As a part of a system of a community, well-structured, organized, and supported, such as we have here, with its mission being such a broad mission under God to help people as we all are on a journey through life, to figure it out and to be as comfortable and healthy as possible. Again, through the details for our better purpose, which is to be of value to serve the community at large. And having said that, I look forward to hopefully many more years of being of service. And I thank you.